Today, we're going to talk about where tartar really comes from in your mouth. We're going to talk about why it keeps coming back in the same exact spot, and I'm going to show you exactly what you need to do to prevent tartar so it stops happening. You know, at first, when you look at tartar, it might seem like something cosmetic, just some buildup on the inside of your teeth. That's an annoyance, just something that looks bad. But there's something much bigger about tartar that you need to know about, something that affects your whole body, not just your teeth. What happens with tartar is you can see it above the gum line, but some of it grows down into the gum and actually creates inflammation. It creates irritation. It creates bleeding. And this is the dangerous part. That bleeding allows certain bacteria to invade. These bacteria go through tiny little holes in your gums. They go into your tissue, and then they go into your bloodstream. This is why people with tartar experience bleeding when they brush their teeth, because there's irritation and inflammation deep in the gum area. This is real. This is happening in your mouth right now if you have tartar. There are actually certain studies that show bacteria can increase by 23% after you brush your teeth and irritate your gums. That's a significant increase in bacteria, and there's even research showing that professional deep cleaning can increase bacteria in your blood up to 75%. That's bacteria going right from your gums into your bloodstream. That's not something to ignore or take lightly. And what's really wild is they've done DNA testing on heart attack patients, on stroke patients. And what did they find? They found dental bacteria, bacteria from your mouth, in the arterial plaque, in their heart vessels, in the walls of their arteries. How did it get there? It came from your gums. It entered your bloodstream. It traveled through your circulatory system. It embedded itself in your arterial walls. This is how dental bacteria contributes to heart disease. This is the mechanism. This is proven in the laboratory. They've also tested the synovial fluid in the joints of people who had rheumatoid arthritis. And what did they find? Dental bacteria. Bacteria from the mouth, in the joint fluid. How the heck did it get in there? Through your gums, through your bloodstream. Even in conditions like gingivitis, they're finding now there are links between the enzymes in that condition that can trigger autoimmune diseases, specifically rheumatoid arthritis. But I remember a lot of those cases having serious problems with their teeth and gums. The connection is real. The connection is documented and proven. So tartar is not just a cosmetic problem. It's not just about how your teeth look. Tartar could be a much deeper systemic problem. Tartar could be affecting your heart. Tartar could be affecting your joints. Tartar could be triggering your immune system to attack itself. This is the reality of modern dentistry. This is what we're learning from research. Your mouth is not separate from the rest of your body. Your mouth is connected to everything. As a health expert, I see this connection constantly in my practice. Patients come in thinking they just have a teeth problem. They don't realize their mouth is sending bacteria into their bloodstream. They don't realize those bacteria are reaching their heart, their joints, their organs. This is preventable. This is fixable, but you need to understand what's happening first. So what is the difference between tartar and plaque? Because people use these words interchangeably. They're not the same thing. Plaque is basically soft. It's living. It's bacterial biofilms. It's not yet calcified. It's living on the inside of your mouth right now. The chemistry of plaque is more acidic, and in that acidic state, you increase your risk of getting cavities. Cavities are caused by acidic plaque. That's the mechanism. But tartar is different. Tartar is fossilized biofilms. It's hardened. It's in this chemical cement. Once tartar forms, it's impossible to take your toothbrush and try to brush it off. It's not coming off. It's gone for good. That's why when you go to the dentist, they have to use a metal tool to scrape it off manually. Your toothbrush cannot remove tartar. Only a dentist can remove tartar. What's interesting about tartar is you have more of an alkaline environment. In an alkaline environment, you get less cavities, but you might have more tartar. So fixing your pH doesn't solve the tartar problem. That's the issue. If you change your mouth to be more alkaline to prevent cavities, you might increase tartar. It's a trade-off. So why does tartar form in the same exact spot in your mouth? This is the key question. This is what patients ask me all the time. Why does it always come back in the same place? There's a little gland, a salivary gland, in these exact spots. And they're sitting below the jawline, and they're draining through a little tube. And that tube opens right behind the lower front teeth. And here's the critical part. The saliva that's coming out from those glands is way more saturated with calcium than even in your blood. Your saliva at that spot has more calcium than your blood. That's why tartar forms there. That spot has the highest concentration of calcium-rich saliva in your entire mouth. So the real problem is not that you're consuming too much calcium. It's not that you're drinking too much milk. The real problem is that saliva is already primed to dump a good amount of calcium in that exact spot. Your body is flooding that area with calcium-rich saliva. And here's what's interesting. Some people never get tartar, and other people get tartar constantly. Why is that? What's the difference? I see this in my practice all the time. Two patients with identical diets, identical habits. One gets tartar, one doesn't. What they found with people that don't get tartar is they have a lot more inhibitory chemicals. These are chemicals that stop the formation of tartar. These are natural protective compounds in their mouth. They naturally prevent tartar from forming. But here's the problem with tartar. Once you get it, tartar itself tends to destroy those inhibitory factors. Tartar produces compounds that kill your natural tartar-fighting chemicals. So people that get tartar get more tartar. It's a downward spiral. Once you get it, your mouth becomes more likely to produce more. The other really important thing is, when you go to the dentist and get your teeth cleaned and they scrape off the tartar, it's absolutely critical that they also polish your teeth afterward, because that roughened surface that occurs after the cleaning can now provide the perfect surface for bacteria to stick to and start growing again. If they just scrape and don't polish, you're setting yourself up for tartar to come back faster. The polish is essential. Now, here's the missing piece of information that you need to know to really understand how to prevent tartar. This is critical information. It only takes 8 hours for crystals to start forming on the inside surfaces of the lower teeth. Just 8 hours. That's one night of sleep, one night without proper brushing, and the process begins. And then 2 days later, you could literally have up to 50% of those mineralized, turned into calcium, turned into solid tartar. That's 48 hours, less than 2 days. And then at 12 days, 90% of those biofilms have turned into calcium, into tartar, into that hard rock on your teeth. This is the timeline. This is how fast it happens. Once the fossilized cement has formed, once it's tartar, only going to the dentist and getting a professional cleaning is going to work. Once it's tartar, you can't fix it at home. Your toothbrush can't touch it. Only a metal scraper can remove it. So what I'm going to show you is how to prevent tartar after you go to the dentist. After you have the scaling and the polishing, which is absolutely essential. I'm going to show you exactly how to prevent it so it doesn't keep coming back, because you don't want to be going to the dentist every month. You don't want this cycle. The first step is brush twice a day. Not once, twice. A lot of people brush once in the morning, and that's it. That's not enough. You must brush your teeth twice a day. This is non-negotiable. So right before you go to bed, make sure you take a toothbrush and spend more time on the inside surfaces of the lower teeth, about 30 seconds on that spot. Get precise with your technique. Get intentional about where the bacteria are growing. Try to get as close to the gum line as possible without irritating it. The biofilm is growing fastest at night. You're sleeping. Your mouth isn't being cleansed. The bacteria are multiplying. Your saliva production decreases when you sleep, so you need to brush right before bed to remove that biofilm before it can start mineralizing. You're interrupting the tartar formation process right at the beginning. And in the morning, you need to brush again. That's the minimum protocol. Twice a day, consistently, every single day. This removes the soft plaque before it can mineralize and turn into tartar. You're breaking the cycle at the earliest stage possible. You're preventing tartar from ever forming on your teeth. This is the key strategy. Prevention is everything. Once it's tartar, it's too late. You need a dentist. But if you prevent it, you never have to deal with it. The second step is sleep with nose breathing. This sounds simple, but it's powerful. This is one of the most effective interventions for preventing tartar that nobody talks about. When you sleep, breathe through your nose, not your mouth. This is critical, because if you're sleeping at night and your mouth is open, you're going to have more production of saliva. But wait, that sounds like it would be good. Actually, no. Your mouth dries out when it's open. The air dries out your mouth, and dry mouth means more tartar formation. The bacteria in your mouth thrive when your mouth is dry. That's when they multiply fastest. The saliva is supposed to protect you. Saliva has antibacterial properties. Saliva is your defense. But if your mouth is open all night, you lose that protection. Your saliva evaporates. Your mouth becomes a perfect breeding ground for bacteria. I see this in patients constantly. People who sleep with their mouth open get tartar much faster. People who breathe through their nose stay healthier. It's one of the biggest differences I see. Your nose is designed to filter the air. Your nose moisturizes the air. Your nose warms the air. Your mouth isn't designed for that at all. Your mouth is designed for eating and speaking. Let your nose do its job while you sleep. Keep your mouth closed. Let your saliva protect you. This alone makes a huge difference. The third step is use baking soda toothpaste. Find a toothpaste that has baking soda in it. This is important. Why baking soda? Because baking soda is anti-biofilm. It destroys biofilms. It's antibacterial. It kills harmful bacteria, and it penetrates into small little areas that other things can't get into. Regular toothpaste is thick. It sits on the surface, but baking soda goes deep. It reaches the spaces between your teeth where bacteria hide. It reaches along the gum line where tartar starts forming. It reaches into all the crevices and cracks where bacteria are growing. It's a really good way to prevent the formation of biofilm before it can become tartar, before it can mineralize into that hard rock. A couple of other things that are anti-biofilm are xylitol and zinc citrate. Look for those ingredients too, but baking soda is the key ingredient you need. Baking soda is powerful. Baking soda has been used for decades in dentistry. It works, it's proven. It's effective. The fourth step is professional cleaning with polish. When you go to the dentist and have a cleaning, make sure they also polish the teeth. This is absolutely non-negotiable. This is the step people forget. I always remind patients of this. Ask your dentist directly. Make sure they're going to polish after they clean, because that smooth surface prevents bacteria from sticking. That smooth surface is your defense against tartar formation. Without the polish, the rough surface is an invitation for tartar to come right back within days. The polish is essential to the success of the entire protocol. One thing I want to mention is about people that do the ketogenic diet. Some of them might notice they get a little bit more tartar, and I want to explain why. It's because they're changing the pH of their mouth from acidic to more alkaline. The ketogenic diet changes your metabolism. It changes the chemistry of your saliva. Now the pH is more alkaline, and in an alkaline environment, tartar forms more easily. Cavities form less easily, but tartar forms more. Now, the good thing is, because they're on keto, they're going to get less cavities. They're going to have less inflammation in the gums overall. Their systemic health improves. So they might develop more tartar, but that's actually a good trade-off. They're getting less cavities, they're getting less inflammation, they're getting better metabolic health. The tartar is manageable with these 4 steps I'm telling you about. I wouldn't change your diet because of tartar. I wouldn't stop doing keto because of this. I would just do what I'm telling you right here. Do these 4 steps. Brush twice, breathe through your nose, use baking soda toothpaste, get professional cleaning with polish. That's it. That's all you need. Some people might think, oh yeah, keto is bad. Oh yeah, keto causes tartar. But actually, keto is preventing one problem. It might be increasing your risk for tartar in some people, but not if you do these things. Not if you follow this protocol. So, let me summarize what you need to do. Brush twice a day. That's non-negotiable. Sleep with your mouth closed and breathe through your nose. That's how you sleep. Use toothpaste with baking soda in it. Look for that ingredient. And get teeth cleaning with polish. Make sure your dentist polishes after they clean. This is the protocol. This is what works. This is what I recommend to every patient who gets tartar. And it works. It stops the cycle. Now, what's important to understand as your doctor is that tartar isn't just a cosmetic issue. It's a symptom of something bigger happening in your body. It's a sign that bacteria are being produced in your mouth at high levels. It's a sign that your mouth's natural defenses might not be strong enough. It's a sign that your immune system is fighting an infection in your gums. When you see tartar, you should think of it as a warning light, like a check engine light on your car. Your body is telling you something is wrong, and it's not just about your teeth. It's about your overall health. It's about your heart. It's about your joints. It's about your immune system. So taking action on tartar isn't vanity. It's not just about having clean-looking teeth. It's about preventing serious systemic disease. It's about keeping bacteria out of your bloodstream. It's about protecting your heart from dental bacteria. It's about preventing your immune system from attacking your joints. This is preventable. This is fixable. You don't have to have tartar. You don't have to have gum disease. You don't have to have bacteria in your bloodstream. All you have to do is follow these 4 steps. Brush twice a day. Spend 30 seconds on the inside lower teeth right before bed. That's where tartar forms fastest. Breathe through your nose when you sleep. Keep your mouth closed. Let your saliva do its job, protecting you. Use baking soda toothpaste every day. Let it penetrate into those crevices where bacteria hide. And when you go to the dentist, make sure they polish after they clean. Don't leave with a rough surface. That's it. That's the protocol. That's how you stop tartar from coming back. In my practice, I see patients get frustrated with tartar. They go to the dentist cleans it. 2 months later, it's back. 3 months later, it's back. And they don't understand why. They think something is wrong with them. They think they're doing something wrong. But they're not following the protocol. They're brushing once a day. They're sleeping with their mouth open. They're using regular toothpaste. They're not asking their dentist to polish. So tartar comes right back. Once you follow these 4 steps, the tartar stops coming back. The cycle breaks. Your teeth stay clean. Your gums stay healthy. Your mouth stays healthy. And most importantly, bacteria stop entering your bloodstream. So here's what I need from you right now. First, check your toothpaste right now. Don't wait. Look at the ingredients list. Does it say baking soda? Does it list sodium bicarbonate? If not, you need to get new toothpaste. This is step 3. This is non-negotiable. Make it happen today. Go to the store, buy baking soda toothpaste. You can't follow the protocol without it. Second, tonight when you brush before bed, spend an extra 30 seconds on the inside lower teeth. Focus there. That's where tartar forms. That's where you need to concentrate your efforts. Really get in there. Get close to the gum line. Brush thoroughly. This is step 1. Make it happen tonight. Third, tonight when you sleep, close your mouth and breathe through your nose. This is step 2. Your nose is your friend. Use it. Let your mouth rest and recover. Let your saliva work to protect you. This is how you sleep. Make this a habit every single night. Fourth, when you go to the dentist for your next cleaning, write a reminder. Call ahead. Make sure you ask them to polish your teeth after they clean. Don't leave without the polish. This is step 4. This is essential. The polish is what makes the difference. The polish is what stops tartar from coming back immediately. Do these 4 things. Do them consistently, and tartar will stop coming back. Your teeth will stay clean. Your gums will stay healthy. Your mouth will stop sending bacteria into your bloodstream. This is proven. This works. I've seen it work in thousands of patients. If this information was helpful, if you're interested in the real science behind dental health and systemic disease, hit that thumbs up. It helps more people see this important information because a lot of people don't know this connection. A lot of people think tartar is just cosmetic. They don't know it can affect their heart. They don't know it can affect their joints. This message needs to spread. Subscribe to the channel and hit the notification bell because I'm focused on stuff that actually matters. The research-backed protocols that change your body. If you hit that bell, you'll see it when it's released. But for most of you, start here right now. Do these 4 steps today. Follow the protocol consistently and religiously. Brush twice every single day. Breathe through your nose when you sleep. Use baking soda toothpaste. Get professional cleaning with polish. Consistent. Every day. No exceptions. That's it. That's the complete protocol that works. Your teeth are a window into your systemic health. Your mouth is connected to your heart. Your mouth is connected to your joints. Your mouth is connected to your immune system. This isn't just theory. This is documented in medical research worldwide. Take care of your mouth. Take care of your health. It all starts with prevention. It all starts with these 4 steps. Brush twice. Breathe through your nose. Use baking soda toothpaste. Get professional cleaning with polish. Do these things consistently. Every single day. Every single night. Don't skip any steps. Don't make excuses. Your health depends on it. Your heart depends on it. Your joints depend on it. Your immune system depends on it. This is worth your time and attention. I'm Austin Pratt. I'll see you in the next one.